With this session update, I'm Shannon Lurkey. This morning, Governor Walz met with legislative leaders to discuss a number of session priorities, including replenishing the Unemployment Insurance Trust Fund, providing hero pay to frontline workers, and a bonding bill. Governor Walz took questions from the press following the meeting.
Good morning, everyone. First full day of spring in Minnesota, so just like spring, optimism abounds. Just coming out of a leadership meeting. Hopeful. Talks are still happening. I think we're trying to level set where folks are at. We have believed all along that Minnesota's financial picture puts us in a strong position to get win-wins that support our economy, support workers, support our businesses, invest in education, provide some relief to families immediately. All those things are still there. We're still trying to deal with what I think is a time-sensitive issues around keeping our promise that we made last June to frontline workers, and then making sure that we're providing stability in the UI Trust Fund, especially to employers on their payments into those funds. Not much movement today on that, but I think more of a clarification that there is a lot of space in here to negotiate a win-win. We're at the point now where we're starting to be a little more specific about asking for offers and counter offers to kind of start moving. And then we spoke a little bit about, I think with great optimism from all the legislative leaders, that a bonding proposal and a bonding bill will certainly be something we need to get done. And that was really encouraging because the minority leaders, Senator Franzen and Leader Doubt, both expressed optimism that their caucus is prepared to talk about that and get a fairly substantial bonding proposal done. So we're here again, the first full day of spring. We've got about 8 weeks left, about 40 working days if they're during the work week. So things need to start moving. Again, Minnesota's in a strong position. The situation around COVID is much more stable than it has been in a long time. Our hospital numbers are down below 275, I believe, in terms of folks in the hospital. All of those things, of course, bode well as we try and get through this legislative session. So be glad to take any questions or concerns.
You said optimism abounds, but there wasn't much movement. How do you square those things?
Yeah, I think these things are sometimes it's by perception. I think there was more conversation. There were a few more things put on the table. We discussed, I think, quite productively issue around reinsurance, which is something I've made no bones about. I think is not a great and effective way to make sure that Minnesotans have affordable health care, but it is a tool that helps reduce costs, and we've compromised around that in the past. And I think with a deadline coming up to alert CMS, the federal government, there was some conversations around that. And there was, I think, a little more optimistic banter. Again, you're absolutely right. It's going to come down to what's on the paper and what's able to get through both those bodies. But I think encouraging the legislature to see themselves as allies, to see those differences of opinion as a strength, and to never forget that we are in a strong position. If we would take the compromise that Lieutenant Governor and I put forward to refill the UI Trust Fund and do $1 billion to frontline workers, that still leaves us with roughly $7 billion to deal with these other issues, which puts the other priorities clearly in play after that. So while there's nothing down on paper yet, I think these things have a tendency to ebb and flow, and it felt like today that there was more goodwill and a desire to get this done. Could be that it's 60 degrees out, but I also think as you near closer to the deadlines, people start to compromise.
Question. Nobody stormed out.
Pardon me?
I said at least nobody stormed out, so that's
yes. No, we all stayed, and I think that does matter. That people are passionate about this. Emotions get high, and it was a very cordial, and I would argue you're trying to set and say this is what needs to happen now. You need to go back to your caucuses and get some agreement. People again and we're the same way, negotiating with yourself is not a great strategy, but I do think it's important to somewhat publicly make the case and say it. We're willing to compromise. I've said that every time we've stood in front of you. I need to hear that from legislative leaders a little bit more. But they have a little harder time because they have got to build a majority.
Before March 15th, there was some question about are businesses going to pay these taxes right away, creating more of a headache and unwinding it, or are they going to hold on to it? Do you have any update from DEED, like what you're seeing a couple of days in here?
Yeah, well, I still believe that our numbers and dates were correct. I think businesses are already beginning to pay that. I'll get you some examples because I've asked my team as we saw the 15th pass if we start to see some receipts coming in. But there's no doubt, I mean, these businesses are they're smart and they can't guess on things. And I wouldn't, if they're betting on the legislature getting something done, I would not take that bet. And I think that's what's the bad part about this. That's why we came out as early as December and said, why don't we get this done way before there's a deadline so that they don't have to deal with this. But we do know that they are going to start to do it. I'm asking Deed to figure this out, but I don't want to mislead anyone that it's going to be a little bit complex to unwind this and how we do that as a credit or a rebate or how that actually is going to work. I'd just rather not do that. And we simply, every day we go by, more businesses are going to be paying.
Governor, is this still a one-to-one frontline workers and UI, or is reinsurance, you mentioned, bonding, are those things getting brought in?
You know, no, that's a great point. Again, I go back to my example as the Rubik's Cube. We're trying to do it with two colors now, UI and frontline workers. I would have thought that had been easier, but I think some of you know that's not a great analogy sometimes, that there's complexities to build coalitions to bring more folks in. So we've mentioned that. Is there an idea? I make the distinction that dealing with UI and dealing with the frontline workers is taken care of at the heart of the pandemic. The frontline workers, we agreed upon that, signed it last June, so that should be taken care of. And the UI issue was caused by the pandemic. And so I still make the distinction that I think we should deal with those two, but I'm certainly open if there's a new proposal in here that would help move some folks along to support those things, then we're welcome and would be willing to hear them. That has not been formally proposed, but as I said, there have been a few more issues like bonding and reinsurance have been discussed. Whether that will look like a broader package, I can't say how the legislature would do that. I'm certainly willing to entertain anything that moves some things along.
Governor, you've had a paid family leave proposal on the table for your entire time as governor. The Republicans put one forward today that would be based on a private product that employers could access and potentially get tax credits for per employee. What do you think of that?
Yeah, we're excited about the movement. I'm going to have Lieutenant Governor's been our lead on this issue, and we've held some roundtables. Lieutenant Governor's worked on it, but I would just say on this is a real positive development. Republican legislators talking about paid family leave in a very positive way. The mechanisms, I'll let Lieutenant Governor.
Yeah, so we haven't fully looked at the proposal yet, but as you mentioned, this is something that's been a priority for the governor and I the entire time we've been in office. I think we need to make sure that we are focused on the employees, making sure that they have what they need. When we talk about paid family and medical leave, it's to make sure that you can take care of a new child or someone with an illness or yourself with an illness. So we'll need to see all of those things as part of it, but this is a hopeful development. I'm excited that Republicans are ready to talk about paid family and medical leave. Get on board, right? We're ready.
This is a good faith offering to continue the conversation.
We're ready to have this conversation. We've been ready to have this conversation for the last 3 years. So
I do think
I'm hopeful.
Yeah, and I'm going to assume, again, thinking the right things, that this is good for the employees. It's also good for the employers. We know right now is large companies already have this, and they have an advantage, if you will, in a tight labor market. And the small businesses we talked to, we were at some of them.
Yeah, we were at Vinaigrette just, I guess, several months ago now. But having this conversation about what a difference it would have made for this small business to have access to this. So it's about retaining employees, attracting employees, and we're just excited that they're ready to have this conversation. So I'm eager to take a look at the proposal and see where we can find some common ground.
Governor, that's more optimistic than some of your DFL colleagues in the Senate who basically just flat out said that the Republican proposal is not the way to approach it. It doesn't go far enough. I'm curious, how you, with that in mind, how you view it.
Well, we got briefed on the proposal. Those things might be true, but I think, again, I'll go back to a deliberative body. I don't think you can shut down when somebody makes a move. This is the first time we've heard Republicans talk about it. They have shut this down and said that absolutely never, it's a new tax on employers, we don't want to do it, we're not going to deal with it. They're obviously hearing from their constituents to the point where they thought it was important to introduce this, and I don't think it helps with negotiations to immediately. I'm not going to tell the legislature how to do their business or whatever. My style on this would be, I think, as you're seeing it here, is, okay, now let's start talking about what those end results are. So I'm hopeful. And it may be that this proposal is unworkable, but they're moving, and that is a positive thing.
To a degree, just on today's
I was just going to say, to a degree, is this generational? Do you see that? Because, you know, at the GOP press conference, everyone is parents of young children. You have a younger daughter. Is this a generational change?
I mean, I think it's something that we're just seeing that is just needed and necessary. And after 2 years in a pandemic, isn't it clear that we need paid family and medical leave? So I think this is the right moment. We can see other, countries across the world who have this. It's a good thing. 195, but who's counting? So I also think that it's time, right? I remember standing next to Senator Franzen with a photo of my newborn baby girl when I was at Children's Defense Fund talking about this issue. So we are not, new to this fight, but I'm excited that folks are here and ready and they're getting on board because it is long overdue. I certainly didn't have it for my kid, other than through my employer. But I think it's time, and folks are ready. Yeah.
Based on today's negotiations, so last week both you and Speaker Hortman expressed frustrations because you kind of felt like the Republicans had maybe closed the window altogether on any sort of frontline worker. But it sounds like now, and they said that wasn't their intention or the case, but it sounds like now that's back up. Like the 250 is still on the table. Something's still on the table, right?
That's right. That's the way I understand it. And I think this is the things that we don't need to be careful how we talk to one another. We need to be careful how we talk publicly about this, because I think it was our understanding that had come off the table. Senator Miller expressed today that no, that is not the case. It is on the table. They're willing to talk about it. The question is how it's connected to UI and some of those things. But I would argue, once again, much like this discussion around paid family medical leave, it appears like the Republicans are prepared to make kind of a counter offer. The House had made one, we made ours, and now it's time for the Senate. If they do that, and that doesn't mean that that's going to be anywhere close to acceptable, but it's movement. So I think that's a good sign right now. It sounds like the 250 that we agreed upon last year is back on the table. How that's going to look, who's going to be a part of it. Certainly we don't feel now with the change situations from last June to now, both with the size of the surplus and the impact it had on workers, that it's enough, but it's a start.
When do you reconvene?
One more?
When do you reconvene?
That's the staff is setting that up right now. We did not set a time on that. We'll get back later today on that. So thank you all.